One clear example of some good collaboration that happened at that time was the ability to keep commercial goods and essential travel continuing to flow. And then as these restrictions started to evolve, we saw even less and less collaboration and alignment between the US and Canada. The testing requirements that we did have in place, again, we didn't apply them equally to modes of travel. Canada required a test at the land border, the United States did not. Canada required a PCR test, the US required antigen tests. We had different testing windows. We also didn't even accept the same list of vaccination. One, major shortfall in the last pandemic was just that lack of communication from government to the people on the ground. It was very difficult to figure out what was going on, what people were thinking, because there was never actually any metrics around a lot of these policies.
What we learned from COVID is two things. Border closures are really popular. Like, the publics love them. It's one of the reasons borders stayed closed so long, even in a country like Canada that has a long history of recognizing that an open border with the United States is critical to Canada's success and survival. Border closures were extremely popular, and this was the case around the world. And the second big takeaway is, in most cases, they were not very effective. The final line in our book from Dr. Cetron is he thinks we are much less well prepared for the next pandemic than we were for this one. And you can see it around the world. I mean, the breakdown of cooperation globally, really starting in China, and China's failure to be transparent about what was going on, has had these knock-on effects. So I think we're actually, in terms of cooperative responses globally, in a much weaker position than we were prior to COVID, which is not a great place to be at.
Title 42 is the most significant measure that had been put into place at the border. Millions of people were expelled without access to the asylum process, which the United States is legally obligated to give access to under both international obligations and domestic obligations. Despite the dramatic situation with both post 9/11 and with COVID, actually many of the measures taken in COVID went much farther and were in place much longer than under 9/11, although obviously 9/11 has defined so much of our policy, our politics, and the way we travel. This conflation of danger, of migration, of border security, national security, public health, really that we saw around COVID-19 is sort of the progression of how this conflation has infected, there's a better word to use there, our politics and our policy, in particular since post 9/11.